The Love and Leary podcast is where nursing leadership, innovation, and real talk come together. Hosted by nurse leaders Marian Leary
and Rebecca Love.
The show dives into the issues that matter most to today's nursing community.
Each episode features candid conversations, expert insights, and bold perspectives on healthcare, leadership, advocacy, and the future of nursing. Whether you're a clinical nurse, nurse leader, or another healthcare changemaker, Love and Leary offers thoughtful dialogue and practical takeaways to inform, inspire, and empower nurses at every stage of our careers.
Alrighty. Hey, Rebecca, we're back. We're talking about another serious, hard topic. It's what we do. But this one is our first sponsored episode. So this episode is sponsored by B. Braun, who is a leader in smart infusion therapy and safe and effective pharmacy products, patient and provider safety, and sustainable health solutions. So we're really excited to have them sponsor this episode because, I think this is something Rebecca and I feel really strongly about that we want people to know about. And it's something we didn't know about and was brought to our attention a couple weeks ago. So we're glad that we can share this with you.
Absolutely. And, the topic that we're talking about today is actually a chemical compound referred to as DEHP. It's known as diethyl phthalate, which is, in better communications, known as a highly toxic synthetic chemical that is referred to as a plasticizer used in IV products such as bags and tubing that we just learned is facing some interesting times and challenges through legislation in California, which is moving to remove and phase out the use of this chemical. And I think that's the topic that we're here to discuss today, and the conversations that are happening in that space. As Marian, you're a scientist, and as a nurses, this is something that I think is something instrumental that I never even really thought about. What is going into the products that we're using at the bedside every day to deliver medications or the treatments that we're giving to patients?
Yeah, and I think, and I love that you were able to say that because I've been struggling with saying it, so I'm just going to say DEHP. But for those who don't know, and I've learned more about sort of chemical engineering and chemical reactions over the past couple of days when preparing for this, but DEP is a plasticizer that's used in PVC, and PVC is so common. It's in many things. It's in building materials. It's in sports equipment. It's in home goods, and of course, as Rebecca just mentioned, it's also in IV bags. And you need DEHP in PVC to make it flexible. And so PVC is the world's third most widely produced synthetic polymer of plastics, and DEHP, which is what we're talking about today, is the most common class of phthalates, see, I can't even say it, which are used in the plasticizers. So this is where the concern comes into play.
Yes. And, it came into play, which is interesting as nurses, right? I think some of the things that we stand by very, alongside all of our other healthcare professionals is the Hippocratic Oath, which is to do no harm. And I think that the question that beholds to us is, what are our responsibilities to understand the products that are being used in healthcare today, and which, at the point, let's be honest, the end user of nearly every single product on that market that is going to touch the patient is going to be, the nurse is going to be standing between that product and the patient at all points in times. So what is our responsibility as a profession to understand both the delivery systems in which we're doing, and then also our responsibility to possibly bring voice and talks and conversations around this? And I think that's why you and I agreed to do this conversation.
Totally. And folks should know, like, DEHP has been banned since 2008 in children's toys. So it's not safe enough for our children, but it's safe enough to go into medical grade devices that we're using on patients who we're trying to help get better and be healthy. And we're giving them solutions in IV bags and tubing that contain potentially harmful chemicals. And we haven't actually gone into what the adverse effects are, but they're plentiful. And, go ahead, Rebecca.
No, and to you're saying that exact thing. I mean, the truth is, it's well known and well documented through numerous studies that it's an endocrine disruptor, right? It has led to everything in studies in large quantities, right? The question is what potential does it have within this IV community? That's caused everything from reproductive issues, and then specifically in males, it's decreased sperm counts and fertility. It's led to overall increased rates of birth defects in other spaces and altered timing of puberty, everything from kidney to liver dysfunction and disease, and cancer, which has led to the reason why the Breast Cancer Prevention Partners is taken such a strong stance on supporting the legislation in California to ban this. We do know also that the legislation, similar in the United Kingdom, is proposed to also phase out the use of this chemical within medical supply degrade devices over there as well. So this is really the first action that's being taken place in the United States, because we do know it's well documented that it's an endocrine disruptor. What we're uncertain of, and this is where the science of correlation, you know this better than I do, Marian, right? But there's direct causation and there's correlation, and there hasn't been a significant amount of studies in this space, but we can assume, based on the reasons that it's been banned specifically in toys for children, and also PVC, why it's largely been removed from food, is that there is the strong potential that this chemical is leaching into the IV products and IV fluids that are going into our patients, by which these plasticides are utilized within our current medical device foray of products.
Yeah, and there's consistently been studies that have detected DEHP in human body fluids such as plasma, urine, amniotic fluid, and even breast milk. And even if it, there, as you said, there are conflicting studies that about whether the leaching of DEHP actually causes harm or not. But regardless of that, even when the products are incinerated, the release of these highly toxic chemicals, when you incinerate DEHP, can also cause cancer, reproductive and developmental problems, damage to the immune system, not to mention the environmental factors that go into that. So this is a really dangerous chemical, and it's just something that, as Rebecca said, as nurses, as healthcare providers, we should really be aware of. More people need to be aware of it and learn about it, and then help to advocate against its use in medical devices.
Yes, and part of the
seems like a no-brainer.
It does seem like a no-brainer. Why do we do this to ourselves? So the truth is it's just an issue. And actually, there was a big question: was it a cost issue? And based on some of the independent studies that we, to be very honest, we haven't studied a lot of this, seem to show some kind of cost neutrality or potential cost savings. Because I think what we don't realize, also to your point, Marian, is that at every hospital across the country, we incinerate our medical waste, right? So everything, all those plastics, everything that we are putting into those red bags is being incinerated in our hospital systems, which means that we want the less toxic any kind of thing going into this incineration. Because to your point, this is something that, although they have great cleansers and things to do these things, there's still a lot of chemical compounds that we are unable to detect that go into the environment through that entire process as well. So there's sort of a double-sided factor here. Both, is it possible that infiltrating our patients as we're giving them certain kinds of medications at a higher percentage? And also, is it leading to an environmental situation from the way that we have to deal with the waste that currently is in our medical communities?
Well, and the incineration aside, even though we should talk about medical waste on another episode, because
absolutely,
boy, it sucks my soul. But IV bags are one of the most common items in hospitals, right? Millions of patients receive infusions and medications every year through IV bags and IV tubing. So, we're talking about millions of patients being exposed to DEHP annually. Again, when, as healthcare providers, thinking about the care that we're providing our patients, asking the question, and you don't even have to ask the question. I actually learned that it says right on the IV bag in big letters if it includes DEHP in the making of the IV bag or not. Informing yourself and knowing what type of equipment you're using and what it contains, and knowing that there are alternatives on the market, and then talking with your health system about why they're using what they're using and presenting them with information on why alternatives may be better for the patients that you're providing care for.
Absolutely. And, it's really interesting that you say this. And I think the truth is we as nurses just didn't know previously, or have been even encouraged to think about these kind of conversations. And what I found really interesting in us leading up to this podcast was the survey that the nursing beat did around this. And it found actually that 74% of nurses were very much unaware of DHP being used in IV bags and lines. And that after learning about it, not surprisingly, 98.5% of nurses would prefer to use bags that don't have this chemical in it. I think that we as nurses always want to make sure that whatever we're doing does not inadvertently cause more harm to our patients down the road. And based on testimony that we're seeing coming out of the California legislative sessions, I mean, there are many experts, physicians, scientists everywhere out there saying that when they're talking to their patients, they're uncertain that if they are using these bags with DHP, that their patients aren't going to go on and develop further kinds of worse kind of diseases than they have today in which we are treating. And I think that is fundamentally the issue here, that we're saying as nurses, there is an opportunity for us to use our voices meaningfully and also take control of our practice and the scope of the tools in which we use and demand better products for our patients. Nurses have always been the patient advocate, right? We have always been told our number one role as a nurse is to be the voice and the advocate for the patients in systems that sometimes forget that we're dealing with a human in the bed. And this is one such time that we have a chance to actually influence policy as a profession that can change the future of the medical device industry. And I think that's what Marion and I started this podcast about, was how do we as nurses take action to be effective to driving change and using our voices in ways to increase our expertise and our value within this greater healthcare community. And to us, this seems to be one clear way for nurses to do that.
Yeah, and I think, I'm going to say two things. One, I just want to thank B. Braun for bringing this to our attention and helping us bring this to the attention of our listeners. But two, this topic plays in nicely to all the things that we've been promoting on this podcast, like nursing as a STEM field, right? Like the science, technology, engineering, and math that goes into creating medical grade devices, understanding the different components to it, and then how that interacts and affects patients is all STEM. And it's what nurses are doing and what we're asking you to do at a different level in terms of learning more about this, but also the advocacy piece, like using our voice as individuals and as a collective to say, you know what, we want better care for our patients. DEHP and IV bags is not better. It is potentially not better care. And again, there are conflicting reports. So using, your platform to be able to say, this is what we need and why as a profession we need to advocate for both the California bill, which I'll scroll on the bottom, but also just at a local level, again, talking with your institutions, with your other colleagues, and making folks aware.
And this isn't only just coming from us as a nurse too, but this is coming as a mother and a family member. And I'm thinking to myself, the next time that I'm in a situation where I am at the bedside watching somebody getting an infusion of something, looking at that bag and just being aware of it. Because the truth is we know that there's already a host of risks that we've done to our environment that we're all dealing with. And the truth is, the more toxic chemicals we can remove from our healthcare systems and the devices that we use is going to be better for all of us. And it's time that we push the industry forward. It's time to stop being the status quo. And the truth is what I've often witnessed in our experience, and I think Marion is starting to feel the same way, or feels very much the same way, is corporations aren't going to often take these directives into their own hands without actual legislation that forces them to do so. So in this situation, it comes down again to the power of the people to make this happen. And both Marion and I encourage you, if you live in California, to reach out to your legislators and support California AB 2300. But more importantly, if this is a topic that interests you, start speaking about it, start studying it and writing about it. Because again, the biggest way that we're going to make an impact as a profession is elevating our voices, knowledge, and expertise into the national narrative as nurses so that they can no longer question the roles that we have to both advocate for our patients, but the knowledge and skills and expertise that we have to drive forward the changes we need to see in healthcare today. And if there's not going to be anybody who doesn't listen to nurses, the truth is our ability. Most people do tend to listen because when we speak, we drive change. And this is our opportunity to do so, to transform the future of the medical device industry.
So go out, learn more, advocate for IV bags, IV lining, and blood bags to be DEHP free, and support the California bill AB 2300. And yeah, like Rebecca said, please use your voice and our collective power to make a difference for our patients. And thank you to B. Braun for their commitment to the use of safe materials.
And if we all start to take that idea forward in every industry that we work in, perhaps we start to do more for the environment than we realize. It starts with one single step, as we know, Marion. And then after 2008, when they banned it in children's toys, let's hope that we start to phase it out in medical devices as well. Thank you, everybody.
See ya.
Thanks for listening to the Love and Leary podcast. We hope this conversation sparked new ideas, challenged your thinking, and reminded you of the power nurses have to lead change. If you enjoyed this episode, be sure to subscribe, leave a review, and share it. You can find more episodes and join the conversation wherever you do your podcast listening.